Well, good evening, everyone. It's Dr. Ellithorpe. This is Tustin Longevity Center, and this is our weekly Tuesday at 6 p.m. Ask the Doctor Anything. We do functional medicine. We've been doing this, I've been doing it all my life. My dad was in food research, and I'm in my early 70s now. So, all my life long, I've been around health food stores, mom and pop startups back in the 1950s even to now. So I've been around this a long, long time. So I'm familiar with the arena. And what we'll do is we'll ask questions. We do this for our family and friends, for anyone really. And you'll get then, my general response as a functional practicing medical doctor. I'm a standard allopathic physician. And the years after going to an additional training. I did a doctorate in integrative medicine to learn about Ayurvedic and energy medicine and herbal and essential oil treatments and many other things. So the whole field is very, very interesting. It's not taught in medical school, but it is something that should be a part of every medical doctor's experience in learning what patients have done and practitioners have done throughout the centuries. Uh, so we'll try and answer questions. It's not meant to be personal treatment or training on an individual basis. This is just education. So if you ask me about a symptom complex or a type of disease, I'll tell you what my experience, my thoughts and opinions are on this. And then if you have significant questions and you're a patient of ours, you can call our office and it will be forwarded to your healthcare provider here, one of the four of us, and then we'll go from there and get a hold of you or have you follow up. Any acute serious symptoms, of course, you can use your urgent care. But in general, we can talk about most things on an educational basis for just a learning purpose, as how a medical doctor, allopathically trained, a standard physician, would start to look at some of the options that they have. So we have two ways of asking questions. You can go to the YouTube if you're logged in, and you can type in your question, and I'll go to the live questions first. And then we'll go to the email questions. We have tlcdoctors.com, and that is our website at TLC Doctors. That's doctors plural, tlcdoctors.com. And there you can get on our mailing list, and then you'll get notified of these weekly meetings, 6 p.m. to 7 on every Tuesday night. There will be a link then on the notification. You can type in a limited question space for any area you want to talk or get my feelings on. And that's another way you can get your questions to me. So we're starting to get some live questions. By the way, last week, for some reason, we had a computer glitch. And right about a third into the video last week, I was interrupted. So some of these questions, I might have some duplications. I don't know if I answered them last time or not. And we'll try and do our best to get caught up. So in the live questions, we have down here from Jay. Jay says that they've been diagnosed with thyroid eye disease, then taking 600 milligrams of selenium daily, and the left eye bulge has subsided, but still have had the headache. What protocol might you suggest? That sounds like Graves' disease. It's an autoimmune thyroid peroxidase antibodies are generally high, and that autoimmune attack to the matrices of the eye itself and the connective tissues will create the fibrin, elastin, collagen material response that creates this swelling, inflammation. That'll make the eye bulge forward, and it can happen enough to create serious problems for vision, even possible vision loss. So when you start seeing something like that, you have to see an endocrinologist specialist for management. Usually they'll put you on a medication called methimazole, Methimazole helps to block that um, action, you might say, on the receptor site where the um, thyroid peroxide antibodies, these kind of things settle. So that's the standard treatment. Usually they'll do a MRI or a CT of your orbits, your sinuses, and so forth. They'll track your free T3, which usually is elevated. They'll watch your thyroid stimulating hormone, even though you're not on thyroid hormones usually. And what this will do is the TSH will be very, very low, suppressed even. If you're on thyroid medications, we do see the TSH come down, so that's normal. But when you're not on thyroid hormones and the TSH is down and we see an increase in the very active free T3, then we know there's some irritation of the thyroid gland going on. Let me take a sip of coffee. So, what the question is, what protocol might you suggest? Well, follow your physician's advice, your specialist's advice, your endocrinologist. You might have an ophthalmologist also working with the endocrinologist. And we also would, in general, say what causes this autoimmune attack to create Graves' disease. And usually it is felt that this is from chronic low grade inflammation from the damage of the gut lining. Remember, it's only one thin membrane, cell membrane thick. So there's only one cell membrane that separates the world out there and all the irritants from getting inside your body when you eat this stuff. So all these plants have anti nutrients in them. Some call them lectins. These are things that the plant makes to try and repel fungus or viruses, bacteria or insects, so that the plant can survive. Now, you eat this and small, tiny amounts on a molecular level can scratch, irritate the one cell thick cell separating you from the world, and then food can leak through this material, then alarms your immune system. And if it's a chronic alarm, then it can go awry and get some molecular mimicry. It might think that the tissue, fibrous tissue, let's say surrounding your eye, or other areas, the cartilage in your hands. You could get the tissue in your skin. So you could get psoriasis, you could get rheumatoid arthritis, you could get eye disease, Graves' disease, you could get the thyroid disease. So there's many, many expressions of low-grade fire inflammation of the damaged cells from just this chemical we're taking in, lectins, plant anti-nutrients, from eating it over and over. And what are some of the typical ones? Well, gluten in the grains would be one anti-nutrient lectin. Another example would be something like oxalates that are in dark leafy green vegetables. Some people will have a lot of oxalates and kidney stones made and many other symptoms. So gut health and repair is the very first step we need to do when you have any autoimmune chronic inflammation associated with what we believe is a lot of disease, or the majority starts from your lifestyle and your gut, what you're eating. Your blood type matters. If you're a blood type A, it's more likely that you don't digest as well, which means the likelihood of you eating a higher plant based diet is tremendously increased, because A-type blood people don't digest well, so they like simpler things to digest, like the carbohydrates that are rich in many of the plants, as opposed to difficulty for type A blood to digest proteins and fats. So A's as a class get this low-grade maldigestion, misdiagnosed as gas, bloating, intermittent loose stool, irritable bowel for many, many years, GI colic even as a baby. And then they wind up with having all these plant lectins that are irritating them, and then the secondary chronic inflammatory expression as either some other autoimmune thyroid, joint disease, skin disorder, or other even neurologic disorders like multiple sclerosis, Lou Gehrig's, alateral myotropic sclerosis. So various things can occur. So we would approach it with a carnivore diet, grass-fed, wild, free range, prairie raised material that will not have any of these plant lectins in it. And it's very satisfying. And it helps repair those cell membranes that are lining every cell. Remember, I'm always going to bring this picture up 1,000,000,000 times, and I have been for the last 20 years, telling about phospholipids. Fat and protein needs to repair the damage that's here. To do it like this, you have to eat fat and protein, and a plant-based diet just is extremely difficult, if not impossible, to get all the nutrients and the fats and proteins needed for repair. So we would begin with a carnivore diet. We would also use uh, systemic enzymes, and we would put time restricted eating. We would encourage adequate hydration for circulation and waste removal. Those are the ways we'd begin doing that, Jay. The next question on our live feed is from Jill. She says, "Hi, Dr. E. First, thank you for your live chat and dedication to functional medicine." Well, praise the Lord. Um, I'm just obeying my commander in chief. He's my king, and I live in America. And so I'm just obeying him. What are your thoughts on creatine? Oh, creatinine? Okay. All right. Supplementation for 6-year-old females trying to build, keep muscle. I think it's an excellent idea. I am and was on a little over an hour conversation today with one of our gentlemen who owns and helps create nutraceuticals. We helped him get started with his business many, many, many years ago. And so he always is kind to call and see if we would like to help create a new protocol. And we are actually working on a creatine protocol for high quality, clinically tested, reliable creatine for muscle building in women. Now, in general, I don't like supplementation. I like eating real food. So if you, let's say you weigh 150 pounds, in kilograms, let's call that maybe 75 kilograms, 70 kilograms, then you should have, at least 70 grams of protein in your diet every day. Maybe you could even argue 100 grams. I would aim for 100 because eating meat, fish, chicken, turkey, beef, eggs, these kind of things will be rich in delivering this for muscle building. And then if you add in resistance training 3 times a week for your upper and lower bodies for a good half hour to 40 minutes, that will create the stimulation, to send the protein to the site where you want to build up that muscle. And so we would stress first try eating 100 grams of protein a day. That would be the first thing I would do, and add in weight training 3 times a week, muscle resistance. I like the machines because you don't hurt yourself. But if you're an expert and you know how to use free weights, or you have a trainer under supervision for your good posture and position, then you could do that. But that's the direction I would aim for. Yes, I would drink plenty of water if you do that. And if you're a blood type A, take it with a digestive enzyme. If you're over 60, you probably are not digesting proteins and fat as well, no matter what your blood type is. So you might take a digestive enzyme to help with that. So there you go. Yeah, creatine, not creatinine. There you go. That's right, Jill. We were talking about creatinine, so she put that correction in there. So hopefully that helps you. But yes, we are looking at developing our own clinically tested We'll probably have a trial, and we'll probably invite 50 to 100 of our patients on it. We'll do probably body mass and a chemistry for creatine measurements. And then we'll go on the powder if the person is going to do the exercise and drink the water. And then we'll retest for body mass maybe in a month, something like that. And we'll just check. So we like to test things out. Of course, this always helps when you know the producer and the quality of the company. I like going to these companies and working with the owners to know the kind of quality I'm giving to my patients. Um, the next question I'm going to go to is from the emails that we got. These are some of the ones I think we missed last week when we shut down earlier. Barbara said, what treatment other than radiofrequency ablation relieves facet joint pain? Well, I'll tell you what that is if the spine is on top and they have these little facets and they rub against each other. Maybe a better way to do it would be like this: as one spine is on top of another, just like your knee, your femur is on top of your tibia, and the two bones, are like that, and they rub. If you weigh too much, if you're dehydrated, if you um, go around and do some dangerous things, silly sports, knee injuries, and get trauma, you're going to have the surfaces of those articulating surfaces become very inflamed, and it'll look like this and scratch instead of being smooth like this. And what that means then is the little joints that go down our spine, the facets that lay one over the other, when they rub, they can get all rough too and scratch. And when nerves are exiting outside of our spine at these intervertebral spots, that inflammation, instead of being nice and smooth, can become irritated. And that, for many reasons, and it can create pain um, at the site and the nerve exiting. So, what other than radio frequency ablation, and what that is they're going into the site where the pain is localized, where the nerve is exiting the spine. Typically, this is usually at L1, 2, 3, 4, 5, S1 regions. And they'll put in, so to say, needles, and there'll be a radio frequency that is sent into that area that will heat up the surface, and whatever nerve is going through the area, it'll, so to say, burn it and knock it out. And hopefully the pain is then destroyed. This does help some people. It is a dramatic thing to do whenever you ablate or destroy a nerve. And so you better be sure about what and why you're doing it. And it should be in the hands of someone very experienced, an orthopedic doctor who knows where and what they're doing. And they do it under imaging, fluorescence, and ultrasound, and that kind of stuff, imaging. What would I do? Well, you have to understand, if you have two surfaces that are supposed to work with each other, like your knee, your femur to your tibia on these surfaces, you need to keep the surfaces moist. So a simple low-cost treatment is drink enough water every day of your life. And then, of course, it might make great sense if you use what we do, which is structured water. That helps it be much more um, gel-like structured water. You can look up the video. Gerald Polak, Pollack, Gerald Polak, Gerald, PhD, electrically structured water. Watch that 2 or 3 times, and you'll see how important water is to membrane surfaces, the surfaces. So one of the biggest things to do is hydrate yourself. Half your weight in pounds as ounces of water every day in general. Don't hesitate to salt your food if you're drinking enough water, because if you're dried out and cracking up and dehydrated and turning to dust, this will get all rough. Instead of being smooth and going, it'll be rough. So you want to drink plenty of water every day of your life. You want to stretch. You want to have exercise that's under control. So you want to work with your muscles, and between your facets on every spine, you have 33 vertebrae, I believe. Yeah, 33. I think I'm right. And then between each spinal wing, you might say, or facet, there are tendon muscles on each side of the vertebra and the interspinous along the big dorsal spine. And then there's other lumbricoid muscles and other longitudinal muscles that go down your spine, not to mention the ones in front as well, and your tendons. All these things need water. All these things need exercise. You need to do crunches. You need to do flexion. You need to do side bending. All this helps to move water, lymph, and blood throughout your body with exercise, strength training to keep the muscles in tone, to hold your body up erectly instead of turning into an old person hanging forward with kyphosis in the back. Um, and you need to keep your circulation excellent, because many places like the cartilaginous pads don't have any blood supply. It depends totally on you having a good tiny capillary, good blood flow dynamic. Exercise will help that. Hydration will help that. EDTA chelation will help that. Microcirculation with chelation therapy. High dose vitamin C intravenously, usually given with chelation therapy, ethylene diamine tetracetic acid. And then getting a good night's sleep, having good sleep hygiene, waking up to the sunlight, getting infrared light, enhancing the cell membranes and the electrically structured water of all your cell membranes. Standing in the grass, grounding, so you have the electron ion balancing with your whole body, so you don't become imbalanced electrically. Eating a low carb diet, so you're not clogging up the little capillaries with a bunch of sticky sugar and or fruit sugar. Trying to avoid a lot of antibody formation through a very wild, crazy, spicy entertainment diet with all kinds of variety and spices. Your little poor immune system, trying to protect the lining of the gut, is going to be just overwhelmed with all the spices, all the variety you choose every day, and your poor little gut can't handle all and responds to all that variety and volume. So we teach a more mundane, one day menu eating. So if this is a meat day for a day or two, then you just eat your meat, your roast beef, your meat, and the same roasted vegetable, buttered, salt and pepper for all your meals. And then the next day, 24 hours or 48 hours, you have your roasted chicken with a different vegetable. And these are extremely healing, very low carb. Uh, and this helps heal the lining of the gut. Plus, it keeps the sugar down, and it keeps the autoimmune antibodies from being triggered and sent out along the lining of the gut. So your whole life, immune, blood flow, hydration, range of motion can help you. And you have to do the exercise. You have to do resistance training and some aerobics. Yes, you have to put in effort to take care of this temple, your body, that you live in, and hopefully the Holy Spirit lives in you too, from my Christian worldview. So hopefully that gives you some idea about other things you can do besides the ultimate radio frequency ablation that kind of burns and flames, heats up, and destroys the nerve, exiting those little vertebrae. Okay, now with some live questions. Mari says, "Hello, Dr. E. I've been inconsistent with dieting lately and now have an upper eyelid twitch. Could it be from going in and out of ketosis?" Absolutely not. What it really is more than likely magnesium deficiency and B vitamin deficiency. So I would get a B complex, preferably a methylated B complex. And I test mine, so I can only validate that I really have a very good one, TLC methyl B complex, with high enough doses of all the B vitamins, and then a amino acid albion chelated amino acids, excuse me, amino acid chelated to a mineral with all the minerals. And so that should get rid of it immediately. And I stress myself out as I age, and I'll get a little twitch as well. It's very annoying. B vitamin, magnesium deficiencies, not hydrating with enough water. These are the usual causes, Maury. Hopefully that will help you. All right, back to the email question. So, what's her name? Carol says, I had an endometrial biopsy to determine if there was a problem with trace fluid in the cervical canal on a ultrasound recently. It came out normal. Well, we praise the Lord for that. I've had a tiny amount of spotting, which I suspect is from a painless fibroid in my uterus or from intercourse that has thinning in the vaginal wall of older women. Should I still be concerned? Stop the progesterone estrogen creams. Well, Carol, you need to talk with your doctor who knows you. Get a pelvic and let them look and see if you've recently had the ultrasound and everything looked decent in the lining of your uterus and canal of the cervix. It's not unusual to get mucus formation. That's normal to get a little bit, and you said it was a little bit of fluid appearing in the cervical canal. You can also see a little bit in the uterine canal. These are not necessarily abnormal. And if you're on natural hormones, you're a natural woman with a uterus, you will respond. I, even in my 70s, have a normal cycle because I use my my natural hormones in a cyclical fashion. I'm always on my estradiol every day of my life, but I use my progesterone for 2 weeks, the first 2 weeks of the month. And right around mid-month to about now is the time where I might see a little cycle flow dynamics, well, enough for a light day pad. And this way I know it's my hormones. I know that everything is showing up on time after I finish my progesterone cycle. And so I know it's fine. Now, I can work that with a doctor, my doctor, or you can work that with your doctor, but please don't assume anything is safe just of itself. I'm glad you had the ultrasound. Whoever ordered it should be someone you can talk to about any further spotting, because that should stop eventually, especially if you stopped your hormones. Now, I like hormones because it helps me have a good memory, helps my skin, helps my energy, helps my sleep and my repair time, helps me not have dry skin, dry eyes, all these kind of things. So in general, talk with the doctor who did the order for that endometrial biopsy and discuss these matters with them. But it sounds like it's just from age-related loss of hormone for the lining of your vaginal canal. And if you're still active with your spouse, then this makes sense to use natural hormones. Harlow says, hello, Dr. Rita. I'm in my late 60s. My cardiologist told me today that I skip a beat 1 out of every 6. Should this be concerning? What can I take or do to rectify this problem? She suggested blood thinners, and I said no. So she said to take a baby aspirin daily. What is your opinion? Thank you. Well, I would follow what your cardiologist is telling you. I don't know who you are or what your other factors are, or your other lab work. But in general, just talking about skipped beats, preventricular contractions are not uncommon. And the older we get, we can get skipped beats. To have 1 out of every 6 is noteworthy. They're usually somewhere around 10,000 to 20,000 beats in a 24-hour period of time is associated with some long-term concern of cardiovascular health. So you would have to get the Holter monitor, a stress treadmill, maybe a perfusion test to look at the perfusion of your heart muscles, so they could track your heartbeats for 24 hours. Sounds like maybe that's what they did already. But if you have somewhere between 10 and 20,000, that's what I was taught, in 24 hours, that's getting up there. So if you had, 1,000, 5,000, that does not seem to be associated having extra beats as something we're too concerned about. But if they're one in every six, you need to work with your cardiologist and pursue this further. What I would do in the meantime are all the healthy things I just said to do. Do regular exercise if you can tolerate it. Do your hydration, drink your adequate amount of water. Be very low carb. Try and avoid a lot of plant foods and their lectins and irritants and inflammation generators, because inflammation in the body is also through the messengers of inflammation called cytokines. They can stimulate vascular irritability. And magnesium is probably the number one mineral. You should be really focused on taking a lot of magnesium. I would probably use a 200, 250 milligram, 3 or 4 times a day. A lot of water, walking, regular muscle training, good night's sleep, good sleep hygiene, the lights out, the electronics out of the room. Get up with the sunlight, let the infrared of the morning sun get to you, stand with your feet in wet grass, get grounded or earthing done for 2 minutes, 3 minutes. Take a nice brisk walk for 15, 20 minutes. Have those habits with some good 3 time a week muscle training. Don't ever eat past, say, 4 or 5 o'clock in the afternoon. Low carb, and the extra magnesium with some good standard multivitamin enzymes and these kind of things with your doctor, and see if that doesn't help you. You might also be needing some B vitamins that are calming and relaxing. You might also want to um, do something that is very calming to the nervous system, and that's listening to very good rhythmic classical music. Some use certain sound frequencies that are calming and relaxing. Ayurvedic medicines, things like ashwagandha would be helpful. Um, so these are the patterns and the ways I would start to work on this. But of course, follow your cardiologist. Um, Leo in the live question says, "Hi, Dr. Rita. What would you like to know, or you would like to know my thoughts on a urinary tract infection that turned into a kidney infection? They put me on antibiotics. I have been taking Vascuzyme and the high dose vitamin C powder. Anything else?" All right. So, I would like to know how they determined that you had a kidney versus a bladder infection. Um, so, I'm not so sure that you had a quote unquote kidney infection. Um, but there are separate tests. Whoever your doctor is, ask them to clarify how they separated out that this advanced to a actual kidney infection. Um, but you have to follow their instructions, finish the antibiotics, drink plenty of water, half your weight in pounds. So if you're 150 pounds, half that is 75. That's 75 ounces a day. I would take a walk to help the circulation for your kidneys. Doing EDTA chelation therapy is a enhancement of kidney function, microcirculation to the glomeruli that improves, and we always give it with vitamin C. So that is also an antibacterial, anti-inflammation treatment as well. Um, there's such things as taking cranberry extract, taking D-mannose. There are products that have that in that. The D-mannose is kind of a non-absorbable through the GI tract sugar that kind of coats the bladder and prevents adherence of bacteria. The cranberry is known to have some antibacterial activity. Um, so these are the things that I would recommend that you look into, but do follow up with whoever put you on the antibiotics. Make sure you get a repeat urine clean catch after you're done with the antibiotics to show that the infection is all cleared up. Clarify as to why and how they knew it had gone from the bladder up to the kidney, and what they're going to do to track that and make sure it doesn't do that again. That would be just good follow up. Okay. Let's see, back to our email questions. Um, Linda says, what are causes and solutions of migraines? Migraines. Well, the neurologists are now pretty convinced that we used to think it was a vascular constriction and then vasodilation. Uh, and they seem to be pretty convinced that that is not what causes migraines today. That throbbing feeling with every heartbeat, the auras, the recurrence of headaches, the unilateral side, one side or the other, usually is associated with classical migraines. The post migraine kind of prodrome, kind of feeling worn out, wiped out, dull, memory's not so good for hours to a day or so. These are things that they originally thought that there had been something that stimulated vasoconstriction and so tight it created a type of ischemia, lack of blood flow. And then finally it would vasodilate, and that flood of fluid would then create uh, a tiny edematous area, and your brain would throb because of that change in volume in a localized area. Now they are starting to say and create medications that say it's what is CGP, calcium uh, peptides. Calcium. There's some kind of a calcium peptide relationship that is being identified as a neurotransmitter or some kind of a cytokine molecule, a peptide involved in, I think it's calcium dipeptide. And they're creating certain drugs, fancy names, I can't even think of the trade names, but they block the CGMP um, peptide. And it's injectable. It's a monoclonal antibody. I think they've created even the oral form of this as well. Prior to that, there were vascular managers like ergot derivatives, and there was the triptans, which were uh, blockers for some of the serotonin uptake materials. These can become problematic if you're on antidepressant because they interfere with enzymatic degradation of serotonin. A lot of neurotransmitter, cytokine activities are being addressed with these drug therapies, from sumatriptan to ergot derivatives to these CGMP, if I'm saying that right, I'm not sure, but it's some kind of a calcium peptide blocker, usually by shot, but I think it's oral now. It seems to have the least amount of side effects, these calcium peptide blockers. And is this a solution? No, it's managing the symptom. Again, we go back to what triggered the release of this calcium dipeptide in the first place. And it seems to also activate mast cells and histamine activity, which is extremely irritating to the um, cascade of cytokine inflammation triggering molecules. Therefore, I would rather like to say, over all the 44 years I've practiced and been doing allopathic medicine with functional medicine for 44 years, when I see people clean up their diet, get processed packaged foods out of their diet, anything with a barcode on it, and they're just eating real foods, and they make their own food, and they control this, what spice salts are in them. they're drinking enough water. And I'm just going to say it. I think those who are on that carnivore diet have the most immediate body detoxing, healing of all these membranes, calming down the nervous and all other systems in the body. I have just seen so many of my patients over the decades say, and my migraines are better, my headaches are less. The girls with the menstrual cycle, because that's a little inflammatory time every month when a uh, uh, egg ovulates and there's a burst out, and the corpus luteum is made and the egg moves. That's an inflammatory little rupture there, and that inflammation generates a sense of bodily inflammation that can trigger maybe these sites that will bring on some kind of a headache. So, drinking enough water, having regular exercise, having good sleep hygiene, getting up, getting good infrared light, taking systemic enzymes, eating a very low carb diet to enhance blood flow. These things all matter. That's what I would start doing for migraines, Linda. Okay. There it is. It's calcitonin. Yeah, calcitonin gene related peptide. Calcitonin. So it isn't calcium, it's calcitonin gene related peptide. Yeah, that's the name. Thank you, Mano. So we're a team here. And it's just so great. If you are a doctor, especially if you're a young doctor, you should never be ashamed to admit you're not saying something correctly. Wait till you can go back and look it up, and look at your patients are going to be another source of information coming at you. Receive it, and yes, give your experience, give your opinion. I've been around a very long time, so I have a lot of experience and a lot of opinions. So I don't want to have my patients waste their time on things that I have really experienced to be not useful. But look at how wonderful it was that Mono got me that name, calcitonin gene related peptide, CGRP, CGRP. And that's what these new migraine medicines are all about. But I'd rather prevent them in the first place. See, I don't need this medicine. I don't need the injectables. I don't need them. When I have my patients, and I used to have migraines, and so I applied my own functional medicine on me. You can ask my husband, John, when you see him at the vitamin shop. When I was a very young doctor, massive blowout headaches every month, once or twice. It was incredible. And I still get the scintillating scotometer from time to time without any of the pain. So I know I have a predisposition. Some would call that genetic predisposition. But if I keep on bathing my genes in good, healthy, non inflaming food, diet, rest, exercise, then I'm not going to trigger the expression of it. All right. Thank you again, Mana. And Mana says, think rock, GROK. Okay. So that's where you went to go look for it. Okay. Thank you. All right. Now let's see. Aniki says, hi, Dr. Ellithorpe. I love cheese, avocados, and coffee. Are these okay for a type O blood to consume every day? In general, I teach don't eat the same food every day. Let's say you have this tube from your mouth all the way down to your anus, okay? And let's say you have some holes poked in it just from using it every day to digest your food. But let's say you don't know this, but there's plenty of oxalates in avocados. And let's say there's some in caffeine, maybe there's some reactive mold that came in with your thing, or in the coffee bean itself product. And cheese often has this milk intolerance. So these uh, uh, foods taken in every day will have higher rate of probability of leaking through these holes before they get healed, and your body's immune system reacting to them. So we tend to say, try not to have habits that you do every day, multiple times a week, like the wheat that would be in your cereal, and the wheat would be in your lunch sandwich, and the wheat that would be the crust on your Kentucky Fried Chicken, or the roll you have with your dinner bread, you're getting wheat, 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 and so you're going to probably react to it, whether you have a natural gluten sensitivity or not. So we teach, don't eat those things every day. And just because, we have the income or the car to go and get or buy, or now we have DoorDash to drop at our door, just because we can afford it right now doesn't mean that we should do it. Try and learn to keep food a treat on special occasions and not something you feel that you can have every day just because you can afford it. Um, because my experience over the many years is a food eaten all the time, frequently during the week. When I do those immunoglobulin G antibody tests on immunofoods, I will see that food show up, and the person will say, I eat that all the time. I didn't know it was causing any problem. And then when they eliminate it for 3 months 100%, then we try and reintroduce it maybe once a week, and they have no other reaction to it. It just shows less exposure is probably safe. So Aniki, avocados, coffee, cheese in and of themselves probably are benign, but and certainly to an O type blood, except I would say always tend to have more sensitivity to the dairy products because of homogenization and pasteurization that destroys the milk protein, milk fat, and milk sugars into new, weird, broken up molecules. But in general, if you're eating raw dairy, that should not be a problem, or avocado or coffee. There's a lot of potassium in avocados. You could overeat uh, avocado and get too much potassium theoretically, um, and that could promote some skip beats, irregular rhythms. And then if you drink a lot of coffee, that could be a stimulant. And so there's all kinds of biochemistry that you can think of if you got a good education in chemistry, biochemistry as a doctor. But in general, no, I think they're fine. Try and keep these more in moderation. Now, I will have to admit, I'm the first one up here who probably has coffee a couple every day. And I do times where I just stop coffee for 2, 3 weeks, and I don't get the headache. I don't get withdrawals. So I don't think I'm having problem as long as I can cold turkey stop it and then go back to it. All right. Christina says, "Hi, Dr. Rita. Can you explain how structured water benefits us?" Thank you. How will I do that? All right. So a water molecule is oxygen with two hydrogens on it. So it's a tripartite or a triune. Makes me think of the Trinity of God. And the molecule as H2O is neutral, very neutral. But the hydrogen can come off of the water molecule when it comes close, very close to the membrane. When water comes near to the membrane of a cell, this material attracts the water, and this really is kind of like a water film glycoprotein calyx up here. It attracts water, and you want that because the cell membrane needs the water, extracellular, intracellular. And so when the water molecule comes near to the surface of that cell membrane, instead of being the oxygen with two of the hydrogen here, my two fingers, okay, what happens is when it comes to the cell surface, one of the oxygen, hydrogen shoots off, just goes away, shoo, and it stays as a OH, hydroxy, okay, OH. And now it's negative. Now it's negative. And the next water comes in and it shoots off a hydrogen. And now that one's negative. So what will happen is the water will be negative, oxygen uh, um, attracting the hydrogen of the next one. And then there'll be another one and another one and another one. So you get this tightly packed amount of water that layers the top of the cell membrane surface. That layer becomes electronegative, literally charged. Your cell membranes have to have a transmembrane potential. If you have breaks in your membranes, you mess up the current, and that cell can't perform well. If it's an eyeball cell, a brain cell, a heart cell, a kidney cell, a skin cell, any cell. So when that layered water, structured water, maybe it has, from 10 to 100 microns thick, then you ask, where did all the little hydrogens go that were shut off? Well, they're very close to the top of that layer. Okay, this layer right on the surface is electronegative, and right above it are all those little positive little protons rather. And what that does is, between negative and the positive layer, it creates a electrical potential, which is very valuable to the current electrical needs of the human body. Even some are going to say that not all energy you think from your old training about the mitochondria produces the ATP, adenosine triphosphate, high energy bonds. That's not the only source of energy to your body. They're making the argument now that this differential of electronegative hydroxyl ions and the positive protons just right next to it attracted are creating an energy source itself, and is the reason why blood flows in your body. It's not your heart pumping. It is literally in the capillaries where the blood flow is almost stagnant. What will draw the blood out of that capillary to the venous side? Well, it's the electrochemical charge change from that red cell moving along, and is attracted electrochemically by the hydroxyl ions and protons. How amazing! How amazing! And we can actually see this on electron microscopy. It is just massively amazing. Thomas Cowan, Cowan, Dr. Thomas Cowan. You can put that in YouTube. Dr. Thomas Cowan, The Heart Doesn't Pump Your Blood, something like that. He wrote a whole book on this. Dr. Gerald Pollack describes this phenomena and can literally show you how in the capillary bed, the red cells are pulled along by what we call this exclusion zone, this electrochemical attraction. It is fantastic. So don't tell me this isn't energy and powerful. It's absolutely powerful and full of energy. The water I'm showing you, that is energy personified. And by the way, why do I have this little wand? Because the entire water that's in this wand, I'm going to make a bubble slide. You can see it slowly slide. If I were a carpenter and it took me that long to have my level move the water in my bubble, then you would say that's silly. That's a bad level. But the water is so concentrated in this stick of mine. When I put it on a 3 to 6 degree angle, it only moves very slowly. Why? Because the water is so compact in there, and it hydrates me so well. All right, hopefully that answered it for you, Christina. Watch that video by Dr. Gerald Pollack, Electrically Structured Water. So I'm going to try and do a spitfire answers if it's possible for me to do anything quickly. John says, my friend has been diagnosed with C. diff, Clostridium deficiency, not deficiency, difficile, Clostridium difficile, which usually causes a terrible watery diarrhea, and very often antibiotics, especially in the elderly, can generate this. Now, there are some natural, healthy C. diff bacteria in our stool. So not all C. diff is the same thing. There's different species. Okay, she has been on multiple antibiotics. Well, there you go. And it keeps coming back. What do you recommend? Typically, the treatment for repeat diarrhea, symptomatic C. diff infections is a fecal implant. Someone who has healthy stool, they put a fecal implant. That's the treatment for it. 100%, John. Now, of course, all the healthy lifestyle things I've been saying do in addition, but that's a treatment. Quick answer. Margaret, hello. My dentist came to me had me do the Clifford Materials Reactivity Test before he did dental work. It showed that I am reactive to silver, among other things. Is it okay to take Argentin or colloidal since I'm reactive to silver? I have used Argentin without a problem. Is it better to avoid? Thank you. I've heard of and had some modest experience with seeing the Clifford Materials Reactivity Test. It's an IgG autoantibody response to metals that you can be tested for. I don't have the answer. I can't assure you that it's not safe to take silver, but I all these new systems. See, if we could get money from the NIH, HHS, CDC, and finally get a few dollars to do natural research, then we could do hundreds of patients, hundreds of tests, hundreds of elimination of all colloidal silver versus then repeating the test with a group that didn't avoid colloidal or argentin nanoparticulate silver, and we'll know the answer to this. So in general, I'm going to say silver should be fine, but we need more research. Maxwell says, "Hi, Dr. E. I'm a patient of yours and having an ulcerative colitis flare. I'm on SBI Protect, phospholipids, mesalamine, strict carnivore diet, water, rest, exercise, and prayer. What else can I do to heal promptly? I know systemic enzymes are typically anti-inflammatory, but I hear that they can make ulcerative colitis worse." No, I've never seen that. Thank you so much. I would do high dose vitamin C as well. And I would identify yourself, what your last name is, and then let me look at your chart and talk to you. Call my nurse, Terry, so we can address this to try and help you if possible, or work you in to see you or see your GI doctor. But in general, I would probably have you do the complete digestive stool and certainly some high dose vitamin C drips once or twice a week. Eleanor says, "Hello, Dr. Rita. Are you familiar with Paul Saladino's views on resveratrol and isoflavonoids acting as plant estrogens in humans?" Yes, I am. "And negatively affecting hormonal status?" Yes, it's possible. Also, he says the negative side effects of taking curcumin and quercetin can outweigh any benefits. Your thoughts? Here's where we need the money to do the research. There is such a thing as bad research and bad information put out. I'm going to say I'm going to err on the side of being in favor of quercetin and being in favor of the curcumin. I don't think you could take enough resveratrol or isoflavonoids unless you're a complete vegan and constantly eating soy tofu for protein. I think it's a moot point. There are those who would argue that these phytoestrogen-like molecules block estrogen receptors so that if you tend to be estrogen dominant, it modulates those kind of symptoms. If you have a breast cancer or things like that, it can act like estrogen blockers. So we need more research. Mano says Caldwell Esselstyn. I don't know who Caldwell Esselstyn is. Esselstyn is the last name. First name, I guess, is Caldwell. Says plant-based food is best. You have a different view? It's too simple to say a plant-based diet is best, and I'll tell you why. Not all digestion is equal. A's tend to love more of a plant-based diet because there's much more full of sugar, carbohydrate, fruit sugars, and that's much easier for them to eat. So naturally, they're all going to say, "I vote for a plant-based diet." But we're not made of sugars and fruit sugars. They do have micronutrients and vitamins in them, but you can get all of that from a animal-based diet. Now, I'm not advocating a total animal-based diet. I'm an omnivore, but we have to understand we're made out of protein and fat. There is no essential requirement for any sugar. We can make our own sugars. So in general, there's way too much out there, and there's too much paid science. The sugar industry has already been discovered. Um, the tobacco industry went into buying up the food industry, and that to create addictions to all the sugar, starch, carbohydrate foods. We're addicted to them, and so it's easy for them with all their money to pay off scientists, and there are bad doctors, bad scientists, and they can put out bad science. And I've already mentioned many times before. For decades, I've been telling you that Angela, Dr. Engel, Angel or Angle. She was the chief editor of the New England Journal of Medicine all the way up to 2006, I think it was, from like the mid 90s to 2006. And Dr. Engel said at the end of her tour, where she was resigning, that more than half of all the science published is bought off and bad science. And we're quoting this like plant food is the right way, or this is wrong, this is right. Give me a break. It's bought off science. Get government and lobbyists out of medicine. Get it out. Let it be privatized. If something's worth doing it, then let us raise the money. I've raised money already in my poor little general practice and done my own studies and got them published. There you go. So let's see, what else can I get in here? Methylene blue sounds like a bluing agent my mom put in her laundry. So says Rita. Yeah, it was a dye and a antioxidant whitener. Now it's all the rage. What is it? Well, it's been around for over 100 years plus, and it has electron transport and mitochondrial complex augmentation, you might say, of producing ATP, but also it has impact on coenzyme monoamine oxidase uh, breakdown inhibitors, so that you can get what we call a serotonin flush if you're on antidepressants, tricyclic antidepressants, these kind of things, and take it, you can have bad side effects. I'd rather live a healthy lifestyle than thinking I can buy a product, a molecule to get a antioxidant boost. And so I'm not someone who's in favor of it in general. Harlow says, Dr. Rita, is vitamin D reading high? Blood work shows good kidney liver function. So if your liver enzymes are normal, then that whatever the D number is, it's not harming you. As a fat soluble vitamin, it would harm your liver enzymes. Could the 1 in 6 heartbeat skip she asked about earlier, could that be caused by high thyroid activity? Yes, that's possible too. That's why we always check levels every 6 months to make sure you're in a safe range, and we examine you, listen to your heart, look at you, and see what your symptoms are. Make sure they're in a good spot. Krista says, Dr. Rita, would your online store have your fine products? Thank you for saying they're fine. They're well researched, that's for sure. In powder or liquid form? Not a lot of them, but I am working with a new nutraceutical as of today, and we're looking at doing something more like that. She wants to think of all the daily ones she's taking and are optimal, and all the pills. We want to get rid of pill fatigue. I know I have a little bowl of them myself every morning. And the last one is Anna says, I just had major dental surgery and going through amoxicillin every 8 hours. I had grafting and stitches in my mouth, all due to a bad implant. Do you have a protocol you might recommend to heal and avoid infection? All the things we said. If you can fast, it's probably, this is from today. So if you can fast for 24 to 38, 36 hours, that will be very helpful to build your seal and not have to chew anything. Taking systemic enzyme will help the inflammation go down. Take a lot of vitamin C, swish and swallow, because that helps the collagen elastin form and make a nice seal for your surgery and your stitches and all the grafting that they did. a rich protein diet because everything's made out of protein and fats. You have to have enough. That's why I'm always checking people's protein level, blood urea, nitrogen. Um, what else would I do? I would use Argentine silver, swish and swallow, gargle and swallow it down. I would never eat late. I'd eat in a time restricted zone. So, like if you have that, 24, 36 hours of fasting, that's going to trigger healing growth hormones. And then if you eat rich protein, then you only eat between, let's say, 9 a.m. and 3 p.m. or 10 a.m. and 2 p.m. and fast for another 24 hours. You're going to keep that growth hormone going. Probiotics, I'd be on a lot of probiotics right now. I'd be on the vitamin D for the calcium with K2 for putting in new calcium at the implant site. Those are things I would do. Let's see, anything else in the live? Tim V says, hi, Dr. E. Male friend, 57-year-old, had 2 incidents of rapid AFib over the last 2 years. Cardiologist gave him Eliquis, that's a blood thinner, and metoprolol, that's a beta blocker to slow the frequency down. He didn't want to take, as he's a healthy guy, a carnivore. He's a weight and aerobic trainer. Finally, he agreed to take the medicine and feels lousy. The doctor says he could have a stroke if he doesn't take the meds. He doesn't want to. Thoughts on that? Well, if he has AFib, the quivering of the chamber and the top chamber of the heart may not move blood efficiently, and you could develop a little eddy of current and sticky blood or a clot, and that can be shot out from your left side of your heart into your carotids to your brain, have a stroke, things like that. So that's where that concern comes from. But no one's ever done a study to look at taking systemic enzymes, drinking enough water, being very low carb to not have sticky blood, uh, exercising, keeping the pipes moving and flowing. So they haven't looked at that enzyme and maybe a baby aspirin or just enzymes alone. Because over the many decades I've done this, I've had many, many patients like this guy. And I, of course, tell them follow what your cardiologist says. They did not, but I kept them at least supported them by saying drink your water so you don't get sticky blood. Keep it unsticky with a very low carb, low fruit sugar, low carbohydrate diet. Don't eat late. Move your body. Do aerobic and some strength training. Take systemic enzymes, anti-inflammatory, and I don't think anyone in all my decades ever had a stroke or a follow-up blood clot or heart attack from it. So when is this ever going to be studied and given the validity that my clinical life has seen? So praise the Lord. I have to say, follow your cardiologist. But at some point in time, we need studies so that more and more doctors, if they can motivate their patient, and this depends on the patient. If the patient is going to say, yeah, I'll do it, and they don't drink the water, and they eat all the sugar and the gooey stuff, and they eat late at night, and they don't exercise, and they don't take their enzymes on an empty stomach, well, then of course, they never did it anyway. And they'll probably have the irregular beat. Maybe some blood will have a bad eddy flow, little circulation in the upper atria and get a clot, and it'll be shot out and they'll get a thing and they'll say, oh, well, I saw a functional doctor and I tried to drink more water and low carb, but they really didn't. So who's going to pay for a study like this and monitor these people? It's very hard. So before God, I have to be honest, you've got to follow your cardiologist's advice. You have to be responsible for yourself. You have to understand how serious this is. My personal experience, I've seen enough good patients, wonderful patients who really took their health into their own hands, walked the walk, talked the talk, and they never had a problem. And they got off. Coumadin was the big thing back then. Lots and lots of Coumadin, and they just didn't want to go on it. And now today it's Eliquis or what is the other one? All right, I can't think of it right now, but I'm way over. I'm 9 minutes over. So I'm going to end. It's been a very, very long day. To God be the glory. You are all worth it. You people are created by God and for his glory, and you are so worth serving. I enjoy these days. If it's a value to, please like, please subscribe, and share with your friends and family, and maybe we can all have a healthier us and work more for the kingdom of God. Okay, bye-bye all. See you next week.